Hello and welcome back to the European Health Summit here in Brussels. I'm Andy Bounds with the Financial Times, EU correspondent, and I'm very pleased to introduce our next guest, who is Lars Fruergaard Jørgensen, who is the boss of Novo Nordisk, which is one of the biggest companies in the EU and certainly the biggest health company, and also president of EFPIA, which represents the industry. He's going to join us online.
Yeah, thanks for having me, Andy. I hope you can see me and hear me.
I can now, yes, great. So you heard from the Commissioner there about competitiveness of European industry. How do you assess the competitiveness of European pharmaceutical industry at the moment?
Yes, so I think it's important to acknowledge that our industry is a global industry, and it's an industry built on knowledge, and it's actually quite mobile in the sense that it can conduct its business in many different geographies. And in the sense of Europe, there is a situation right now where the share of R&D conducted is actually declining. So if you go 20 years back, more than 40% of R&D done by the industry was done in Europe. Today, that's less than a third. So I think that's an alarming trend, because that means potentially that be less access to innovative medicines for European patients. And when you do R&D, it typically also leads to manufacturing. And if there's less R&D done, it will also lead to less manufacturing in Europe, so less, say, economic contribution. So I think there's some structural elements that's really important to focus in on to make sure that Europe keeps its stronghold. And if you look at the overall contribution from our sector, it's actually the biggest, say, net contributor of positive trade surplus of any industry in Europe. So it's often not well understood, but it's actually a significant contributor to European economy. And it's the economic activity that's also funding government's ability to pay for healthcare. So having that ecosystem where economic activity leads to tax payments, that leads to ability to fund healthcare, I think is a very positive circle. And if it turns negative, I think we're all worse off. And I think that's a theme that's not least very important as we have elections coming up in the European Parliament, that we actually create a good, open and early discussion about these elements.
Now, we have this huge reform of the pharmaceutical industry which came out of the Commission earlier this year and is going through Parliament and the usual process. What are your thoughts about that pharmaceutical package's strengths and weaknesses for the industry?
There are certain elements that we like in terms of progressing the regulatory environment, because while healthcare policy is a national agenda and it's decided by each and every country, there are some common regulatory aspects, the European Medicines Agency and how that is working. So there are some positive elements there. But when it comes to the overall ambition which we share, which is to make sure that Europeans have access to innovation, there are some proposals there regulating data exclusivity, for instance, aim to make sure that all European countries can have access to medicines, that we believe is actually going to lead to the reverse, actually that there'll be less innovation for countries to consider in Europe. So if you reduce, as we just spoke about in the prior discussion, if you reduce IP, in this case in the sense of regulatory data exclusivity, it actually leads to the risk of less clinical activity being done in Europe, and as such less products to be developed, and i.e. less options for national healthcare systems to actually consider of adopting innovative products for patients and solving some of the healthcare challenges we face. We share the objective of getting products to patients, and the industry has actually committed for the first time to make it very transparent where we are in the regulatory process, country by country. We are committing to filing within 2 years in all countries. But then I think we should also have the discussion about that actually different countries have different wishes in terms of adopting innovation. And sometimes there's not an interest in a certain product. So if conditions for the industry is linked to all countries adopting a certain product, and there's actually lack of willingness to do that, and that leads to lower IP protection, and that leads to less activity in research and development, less economic activity, I think we go into this negative spiral where we are all worse off. And I think we need an open discussion about how the market works, what are incentives to do research and development, and how to share the right balance in risk and reward for that with society.
So if you're looking forward for the next few years, if we want to reverse this decline in Europe's share, or even just maintain where Europe is, I mean, what do you think needs to happen then?
I think there is a real option for Europe to stay a strong contributor to R&D, building health resilience, and also building strategic autonomy. And like the Commissioner just mentioned, when we face shortage of medicines and at the same time have less R&D, research and development taking place, I think that's just going to further fuel Europe being a market that's getting less attention. If we instead actually talk about how can we make this sector that's the biggest contributor from a trade surplus point of view strong also in the future, by really having close dialogue, making sure that we understand how the market works, and actually also acknowledge that the industry is actually committed to make sure that patients have access. And we figure out this right balance from a policy point of view, where it's the individual countries who decide what medicines they use, and what we do at EU level should not be, aimed at individual countries, but overall protecting, the economic activity level. Then I can promise you that the industry is committed to seek access and also pick pricing points that's linked to the economic activity level in a specific country, so that our medicines can be affordable. Because none of us really conduct R&D without having the perspective of getting to as many patients as possible. So I think there is a real opportunity now, as we have elections coming up, to get that discussion as integrated as possible, and really build a shared objective, a shared understanding on how to do this in the best possible way.
Okay, that's a very clear message, and I hope I'll be looking forward to reporting about that debate ahead of the election. So thank you very much for your time, and yeah, thanks a lot. Please show your appreciation for Lars.